The UK is facing a crisis as millions of citizens are absent from work due to long-term illnesses, with a staggering 2.8 million people affected. This issue has been building up over time, and the pandemic has only exacerbated it. But here's where it gets personal. Roni Jones, a former NHS manager from Cornwall, found herself in this predicament after a life-changing Easter weekend 4 years ago. Jones, once a self-proclaimed workaholic, had a harsh awakening when she was diagnosed with a debilitating neurological condition. This condition, known as multisystem dysautonomia, causes excruciating pain and fatigue, making it challenging for her to even get out of bed, let alone work. Her story is a stark reminder that anyone can fall victim to long-term sickness, and it's not just about being a malingerer or having yuppie flu. The statistics are alarming. Since 2019, there has been a 40% increase in the number of working-age people off work due to long-term sickness, with 800,000 more people affected. The number of working people reporting work-limiting disabilities has also risen by 30% to 4.1 million. If this trend continues, the economic cost will be immense, with £66.3 billion lost in productivity by 2030, according to the Centre for Economics and Business Research and Zurich Insurance. So, what's causing this surge in long-term sickness? It's a complex issue with multiple factors at play. Firstly, mental health problems are on the rise, particularly among younger workers aged 16 to 34, with a 77% increase since 2015. This age group is also the least likely to make the transition from education to work, according to Mark Rowland, CEO of the Mental Health Foundation. He attributes this to 4 mega trends, including reduced stigma, rising economic insecurity, and the impact of global shocks like the pandemic and climate change. Secondly, musculoskeletal conditions are affecting a significant portion of the workforce, especially those aged 50 to 64. These conditions, along with chronic digestive, circulatory, respiratory, and nervous system diseases, are the second most common reason for long-term sickness. The aging workforce and the decline in birth rates are contributing factors, according to Ben Wilmot, head of public policy at the CIPD. The impact of long-term sickness goes beyond the individual. It affects their families, the economy, and society as a whole. Failure to treat physical symptoms can lead to mental health problems, with 59% of those economically inactive due to long-term sickness experiencing moderate to severe depression. This highlights the need for a holistic approach to healthcare and the importance of early intervention. But here's where it gets controversial: are employers and the government doing enough to support those with long-term illnesses? Claire McNeil, CEO of Timewies, a nonprofit consultancy on flexible working, questions the quality of work and its role in increasing sickness rates. She believes employers should offer more flexibility to young people managing mental health conditions and have a moral responsibility to ensure good quality employment. The statistics support this argument. In 2022 to 23, 1.77 million workers suffered from work-related ill health, resulting in 31.5 million lost working days. Of these, 875,000 experienced work-related stress, depression, or anxiety, while 473,000 had musculoskeletal disorders due to their jobs. Inadequate line management and a lack of training for managers are cited as contributing factors. The solution, according to Rowland, is a system-wide reform. He argues that the UK invests almost nothing in prevention and early-stage support, with most resources going into treatment once people are already ill. He points to countries like the Netherlands and Australia, which offer financial incentives and grants to employers for investing in ill health prevention and promoting health and well-being. The government's response, through the Connect to Work program, aims to provide job advisors in GP surgeries and help 300,000 sick or disabled people into work by the end of the decade. However, critics argue that this is not enough. Timewies' McNeil believes the government must provide clear expectations, incentives, and guidance for employers, along with an enforcement mechanism, to create real change. The personal stories of those affected, like Roni Jones, highlight the human cost of long-term sickness and the need for a shift in attitudes. As Jones poignantly asks, "What do you do to us when you think all of us are malingerers? Come live my life for a week." This crisis demands our attention and action, and it's time to rethink our approach to healthcare, work, and social support.